I'm joined by Chris Holt, Director of Healthcare Policy at the American Action Forum, a conservative think tank. Chris, the American Action Forum has done a study, and you've got a map to go with it, showing what rates in the exchanges are going to be like for the so-called young invincibles. Right. What did you do in the study? What are we seeing on the map?
Sure. So we're very interested at the American Action Forum in how the young adults, 18 to 35-year-olds, are going to interact with this new health insurance market that opens up in 2014. The administration has identified them as a key critical demographic in the exchanges functioning properly. They say they need about 2.7 million young invincibles to enroll in order for the exchanges to function properly. That's because they have lower health care costs, and so their premiums are able to subsidize, offset the costs that you would see in older and sicker populations.
So you've mapped on here and what you think are going to be the increases in the amount that these so-called young invincibles, 30-year-old non-smokers, are going to pay in these states. So what's your point about that? What do you think that we're going to learn from this?
Right. So specifically, we looked at a 30-year-old male, and we looked at the lowest cost option that he had in each state this year, 2013, and the lowest cost bronze plan that's available to him in 2014. And then we looked at the difference between those two, and what we saw across the country on average is a 260% increase premium for that lowest cost option.
And I should say, to start with, your numbers are a little bit different from some of the things that HHS has put out. They put out numbers for what they say the lowest cost bronze options are going to be for a 27-year-old, which is closer to 30-year-old, and they're much lower than your numbers.
Right. I mean, generally where HHS puts out numbers, they're looking at after the subsidy. So they're taking into account how much that premium has been reduced by the subsidy.
And that's how much people are going to have to pay.
Right, which we look at the end of our study when we look at the cost benefit analysis.
So anyways, to get to the bottom line of it, what's your conclusion? What are people going to do? What are the behaviors going to be based on this?
Right, exactly. So when you think about a 30-year-old young invincible, someone who's chosen not to buy insurance in the past in an insurance market that was much less friendly to that decision than this new insurance market will be, and then you look at across the board, every state shows an increase. I think all but 7, we looked at the District of Columbia as well, all but 7 showed increases of over 100%. And then you look at the penalty, which is only $95 in the first year. It's very small. In some cases, the cost of buying insurance is 10 to 1 more expensive than just paying the penalty and waiting till next year.
But the cost of not buying insurance also means that you don't have insurance.
Right.
So presumably, there's going to be some effort to communicate to people, and people are going to understand that they need to have insurance. It's not like everybody's going to do a cost-benefit analysis and say, well, it's cheaper for me to get the penalty and no insurance.
That's true, but keep in mind we're talking about people who have chosen not to buy insurance up until this point. Right? Where we're looking to insure people who have been willing to take this risk in a market that didn't ban pre-existing conditions, didn't insure guaranteed issue, and actually had rates that were lower that they could pay if they'd wanted insurance than they have now.
And some of the early data in Connecticut, for example, a third of the people who have signed up so far, admittedly it's low numbers, have been under 35. So maybe it's because they're the only ones who can figure out how to make the thing work.
Point that this online exchange seems to be having problems. I did see a story on Connecticut. I didn't see a total, so I don't know how many people we're talking about.
A couple thousand.
Right. So,
if you're right, and the young invincibles decide that they're not going to sign up in large numbers, that it's more cost effective for them to just pay the penalty, what happens to the Affordable Care Act as a whole?
Well, the exchanges won't have the risk pool they need to function, and you risk potentially turning into what's called a death spiral, where the insurance rates have to go up in each following year because there's not enough revenue coming in to cover the costs, and so people who maybe weren't quite so healthy start to find that, wow, these rates are getting really expensive for me, I'm just going to drop out, and you end up with a sicker and sicker pool in exchanges.
So when will we know actually what's happening and whether this kind of death spiral that you've talked about is going to happen?
Right. So the first I think time that we'll look at is March, at the end of March, when we're done with the open enrollment, and we'll see what we got in year 1, and that will give us a good indication. The administration says they need 2.7 million young adults to enroll during that time period. So that will be a good checkpoint.
Great. Well, great. Thanks very much. That's this week's show. I'd like to thank my guests, Alicia Loeffler, Rosemary Truman, Ram Iyer, and Chris Holt.